So, without further ado, I just want to give you a little bit of background to the survey. The survey is one of the resources within ARK. For those of you who don't know, ARK is a joint initiative between Queen's and Ulster University. I am based in Queen's in the School of Social Sciences, Education and Social Work. I think that's right, yes. A few of my colleagues here today, and then we have colleagues across various schools in Ulster University as well. ARK was established in 2000, so we've been running for more than 20 years now. We celebrated our 20th anniversary in 2020. As you can imagine, a lot of our celebrations were a bit curtailed, so we kind of see this as our coming back anniversary today. Within ARK, which is Northern Ireland Social Policy Hub, we run 3 surveys, which is the type of work that I'm mainly involved in. We have the Life and Time survey, which we're going to hear about today, which is an annual survey recording the attitudes of adults aged 18 or over in Northern Ireland. And that started in 1998, so we've more than 23 years of data. So that time series element is really important. We also, in 2003, started the Young Life and Time survey, which is, again, an annual survey looking at the issues affecting 16-year-olds in Northern Ireland. We felt it was important to look at that cohort because that is a group who may be leaving school, who may be starting jobs, they may be paying taxes, they can't vote, they can't drive. So there's a lot of flux in their lives and a lot of transformation and changes within their lives. So it's very important to record their attitudes as well, especially as they are going to be the future voters. And then the Kids Life and Time survey began in 2008 with primary 7 children. Again, they're going through changes in their lives as well. So Life and Times, as I said, an annual survey began in 1998, monitoring attitudes and behaviour of people to key social issues in Northern Ireland. We like to think if it's on the Stephen Nolan show, we're talking about it. So today it's mental health. In 2 weeks' time, we have a survey looking at the other divide, which is looking at attitudes and behaviour in relation to income insecurity, poverty and financial hardship in Northern Ireland. So as we all know, it's such a timely issue for all of us. But looking at time series is very important. So some of the questions within the survey have been asked since 1998 and before that, so being able to track changes over time is really important. A little bit about how we do it. Between 1998 and 2019, Life and Times was a face-to-face survey with a short self-completion, and it was very similar to the Northern Ireland Social Attitude Survey, which ran between 1989 and 1996. Then 2020, obviously with the pandemic, we had to switch to an online questionnaire, but respondents also had the option of a video or phone interview for those people who did not or could not complete the survey online. In 2021, same methodology and fieldwork October to December last year, and fieldwork was undertaken by Ipsos Mori, and very pleased that they're able to join us as well for the seminar today. The list or the range of topics asked every year changes to reflect the current social policy debates. So in 2021, we had questions asked of a random sample of 1,397 adults aged 18 or over, looking at good relations, attitudes to minority ethnic groups, respect, political attitudes, community safety and perception of paramilitary influence, the criminal justice system, mental health, COVID-19 work, and income and poverty. So a very wide range. Some questions we have asked over the years, some of them are new to reflect our current environment. So as I said, this is like a pre-launch. Our main launch of the findings and documentation is on the 26th of May, when we will have that webinar I was talking about in terms of income and poverty. And on our website on the 26th of May, you'll find all the questionnaires, the technical reports, tables of results for every question, the data set to download yourself, and research updates. We do have a short research update available today based on the mental health questions, and that's available on our website. But all those other documentations you will find on the website on the 26th of May. So if you have any technical questions, we'll try and answer them today, but the technical report will be available then. So just to finish off with a big thank you to our funders, a wide range of funders, from government to philanthropic, and universities across the world, to the Fieldwork Agency, but of course to the 1,397 people who gave up their time to complete the survey. Without them, we wouldn't be able to do it. So thank you for that, listen to the introduction, and now I want to pass over to Siobhan, who will present the findings on the mental health questions.
Super, thank you so much for that, Paula, and thanks for allowing us to be part of the survey this year. This was a really exciting opportunity at a very timely point where the mental health strategy was developed, but we're going to have to make decisions about which actions are going to be prioritised within that strategy. And also, one of the key elements of the mental health charity, or the mental health strategy, is that theme 1 stuff around early intervention and prevention, and around awareness and stigma and all those things. So it was a useful time then to chart the attitudes and beliefs of the population, to provide that baseline, to look at where work was needed and where we were in relation to attitudes to mental health and suicide and policy priorities in Northern Ireland. So, as you can see, there's the strategy, and the first action there, action 1, is increase public awareness of the distinction between mental well-being, mental health and mental illness, to encourage public understanding and acceptance of how life can impact on well-being, and we've questions in there relating to those issues. Recognising the signs of mental ill health and mental illness, and effective awareness raising methods, and to increase public knowledge of the key measures that can be taken to look after ourselves. Increasing an understanding of mental ill health, and then encouraging public discourse and dialogue to reduce stigma. So we wanted to see where we were as a population in relation to all of these things, and what people in Northern Ireland thought our government needs to do in terms of mental health. So Paula's explained the methods. I just want to add a few other points to that. The questions that we used were drawn from a public health agency survey in 2015. So we can chart this stuff over time, and this was really, really important. So not only do we have 2021, but we can compare those then, some of those questions, with what people thought and felt in 2015. We also worked with the Mental Health Foundation, and I'm delighted to have Karen here today as well, doing on our questions around what the government priorities should be, and there's some actions in there that align very nicely with actions in the mental health strategy as well, so we can see that. So the NILT website, as Paul said, contains all the information, and the technical report will give you the detail of how the sample was established and selected and all the rest, but that's our final sample size. Okay, so let's just start with the questions that were in the survey. So first, the attitude to mental health and mental illness question is the strength of the belief or the attitude that asking someone else for help to deal with a mental health problem is wrong. I mean, there was a time when lots of people fundamentally believed that mental health was something that you had within yourself, that you shouldn't talk about it, and certainly if it was a problem, then you shouldn't ask anybody else for help. Because it was a sign of weakness, and it was wrong to show weakness. So that's really where that came from. And that question's been asked in a range of different surveys. So thankfully in 2021, 91% of the population strongly disagreed with that statement. So you'll start to, you'll get to know the little colours that we're using. So there, the 91% is good. That's a good result. However, we do have that 9% divided up there between don't know and neither. So there are still many people across the population who are on the fence about this, who are not sure. So there's still a bit of work to do there. We want to understand who those people are and what's at the root of those beliefs and attitudes. So that might be our next piece of work, is going into various social groups to find out more about those attitudes. So the second question was, there is less of a stigma nowadays about asking for help for an emotional or mental health problem. So again, we have, the strongly agree and agree is what we want for that. And that's good. I'm getting my blue and my green mixed up because they're very similar there. I thought that was going on for a minute. But no, we're right, 78% agreed with that. There's less of a stigma. And again, the other side of it is getting a lot bigger there, and there's a lot more people in the neither and the disagree and the don't know categories there too. We know stigma has reduced in some sections of society, but there are still groups out there that have that experience a lot of stigma, or believe there's a lot of stigma. Now that one has shown a big jump from the 2015 figures, 15% more now than in 2015. Sorry, 17% more than in 2015. If you look at the other one, it was 10% lower than 2015 was 10% less there. So there's a positive change basically in both of those, but there's still a lot of work to be done. Okay. Number 3, people who experience social disadvantage are more at risk of having poor mental health. Now this is a question that really attests to that debate about nature and nurture and the biological basis of mental health problems. And all of the evidence is really showing us with every new study that emerges that social disadvantage is very, very strongly associated with poor mental health. Yes, there are biological factors there, but the whole epigenetics, the surge in our knowledge around epigenetics, around how the environment influences the expression of genes, whether genes are switched on and off, around the impact of adversities, ACEs, adverse childhood experiences, vastly increase the risk of mental health problems. And of course the influence of stress and pressure and trauma and all of those things. We're now recognising more and more that social disadvantage really puts people at higher risk of having poor mental health. It's not the whole picture, but it's certainly a very, very important part of it. So what our study here is showing that around 3/4 of the population either agree or strongly agree that social disadvantage is associated with poor mental health. And this was a bit of a surprise because we had thought that it might be a bit lower, I guess, and we don't have a 2015 figure for that, but we would want to chart that over time so that we can increase awareness in the population of the impact of social disadvantage on mental health. So that's really good. But there are, we're more and more now seeing the proportion of people who don't know, say neither, who strongly disagree. That's it's over 25%, it's over a quarter of the population there. So there's a lot of work to be done there in terms of improving attitudes and awareness. So the 4th question, this one was fascinating. I find it difficult to talk to other people about my feelings and emotions. Right, so we included this one because we only had a small amount of money and a small amount of questions that we could ask. And this one actually taps into a lot of factors that influence mental health and well-being. So in order to be able to talk to people about your feelings and your emotions, you need to know what you're feeling. You need to have that emotional literacy and that self-awareness. So that's the first part of it. And then you need to be able to articulate it and put a label on it and say it out loud to somebody else. So there's a lot of different things there, and all of the evidence tells us that if you're able to do that, then you have a reduced risk of mental health problems. So the first part of it, that emotional literacy, knowing how we feel, gives us the ability to start to make changes to that. So once we recognise we're feeling a particular way, we can understand that that feeling is a signal, it's data, and then we work on that. We think of, well, what has caused that and how can we change it? So it's using the feelings as data to allow us to regulate our emotional response, to manage our emotions, and to problem solve things in the real world that are causing us distress and problems. So that's really important. The communication part of it is also really important as well, because we're recognising more and more that mental health and mental illness is indeed relational. It's about our relationships with other people. We all felt that during the pandemic when we were separated from others, when we were disconnected. It makes us feel psychologically unsafe. It's almost like our brains are wired together. We bounce off each other. We're part of this kind of common neurological network of human beings. We feel safe in the company of our pack. So being able to connect with others and articulate our feelings and emotions to other people is actually really, really important for good mental health. It fosters those social connections. It certainly improves our relationships, and relationships are key to good mental health. It improves how we connect with our families, with our spouses and partners and our children. So all of this stuff together it's a really good thing to have. So how many people in Northern Ireland in this study, what proportion said that they found it difficult to talk to other people about feelings and emotions? Well, if we look at the bottom bar there, it's got a lot lower here. So the strongly agree is 44% there. So a lot of people, and I guess that reflects maybe people know what they're feeling and are good with the emotional recognition stuff. It's just saying it out loud can be the problem. So it's not as worrying as you might think, but it does indicate that we have some way to go. And of course, if we're talking about getting help for a mental health problem, you need to be able to say it. And nowadays, you might even need to be able to say it on the phone to somebody, to a receptionist. I'm struggling with my feelings, with my emotions. So it's a really important barrier to accessing mental health services if you can't talk about your feelings and emotions to others. And when we talk to counsellors and therapists who are delivering the talking therapies, certainly, the starting point is getting the person to recognise and articulate their own feelings and emotions. So you're a step ahead if you end up going to psychological therapy or counselling or one of those types of therapies. You're a step ahead if you know how you feel and what you feel, and you can actually say it. You know, that gives you a little bit of an advantage there. So I know there's a lot of stuff going on in schools right now, because my 5-year-old's even coming home talking about her feelings and the range of feelings and all. So it's great that it's happening at that level. I just wonder about the adult population and what more we can do there. And again, it's to be very clear, I'm not saying we all need to go around talking all the time about how we feel about things, you know, but it's just good to be able to do it when it counts, when it's needed, when it matters. To have those challenging conversations. It comes into leadership actually as well, being able to have challenging conversations with people and to feel that kind of dysregulation of talking about feelings, but being able to manage it and get through it. And you know, the rewards there are huge. There's a big gender difference there. 40% of women strongly agreed with that statement, compared to nearly half of men. And of course, that kind of matches what we know about men and women and gender differences there. Women are generally believed to be much better at understanding and articulating their own emotions and their feelings. And this has gone up since 2015 actually, which is worrying. It's got worse basically. But that could again reflect the fact that we were in the middle of a global pandemic, and many people had distressing emotions and feelings that they haven't had before, and they maybe weren't able to articulate those because of what we were all going through, or didn't want to express those emotions. So that might have come into that. But certainly there's a lot of work to do there, and this work is in the area of emotional intelligence, mental cognition. That's the kind of general phrases that you would use to describe this stuff: emotional literacy, emotional intelligence, metacognition. Okay. So this is our fifth and last attitudes to mental health and mental illness question. Mental health problems can be prevented before they happen. Again, it's going back to this kind of, is it nature or is it nurture? Is it stuff that's happened to us, or is it just something within us? And all of the evidence is pointing to a little bit of biology, certainly, but there's so much of this is about what happens to us. And a lot of what happens to us we can have some control over, or the structures in society have some control over. So mental health problems, I think the general attitude is that they can be prevented. Certainly a large proportion of them can be prevented before they happen. So let's go into the figures for that one. Again, we have 49% of the population there believe or agree or strongly agree that mental health problems can be prevented before they happen. So, you know, when we've got a whole theme of our mental health strategy, which is about early intervention and prevention, that is all of the work that we need to be doing to prevent mental health problems and applying all the knowledge that we have. And only half the population really believe this. I think there's a lot more work that needs to be done there. And a lot of people there in the neither category and the disagree and the don't know there. So that's something that we might want to perhaps look at. It's very interesting when you put this in the context, and I'm sure Karen will talk about this, of the Mental Health Foundation's recent report, which showed us that 3.4 billion, that's the cost of mental health problems to Northern Ireland economy every single year. And that's a very conservative estimate because it doesn't include addictions. And there's lots of other different things that it doesn't include there, dementia, and to think that a lot of this stuff can be prevented. We can push that way, way down, particularly by reducing childhood adversities and ACEs, and by intervening early to help people manage their emotions, to give them that resilience, to give them that emotional literacy. We can prevent a lot of that suffering, and a lot of the costs of that suffering as well. So really important area of work there. Now, let's look at the beliefs about suicide questions. The first one, if a person has made previous suicide attempts, it means they won't do it for real. And this is one of the myths about suicide that sadly still prevails. And when you ask people, they may not necessarily say this, but whenever you look at how people who are suicidal and people who self-harm, for example, are treated in our emergency departments and how they report that their behaviour is dealt with and managed, you can see very clearly that a lot of people really do still believe this. And it's absolutely untrue. In fact, a previous suicide attempt rapidly increases the risk. It massively actually increases the risk of suicide. So that is absolutely untrue. And even self-harm, where the intent is not to die, where it's not a suicide attempt, that also increases the risk that that person will die by suicide. It increases their capability. It overrides that kind of that self-protection thing. It's about the experience and practice they have in harming themselves. So it increases the risk of suicide there too. So, and this is where I think the results are really, really fascinating. The proportion who strongly agreed with that is 2%. So it's only 2% of people in this survey actually believe that, which is really, really important that message is getting through to hopefully the majority of people. Although there's still a lot of people in the neither and the don't know sections there. And really interestingly, this went way down. So the proportion that have believed this has went way, way down since 2015. It's reduced by 14%. So that's important. So another one, talking about suicide or asking someone if they feel suicidal will encourage suicide attempts. This one's really important because a lot of my work as a researcher involved asking people if they had ever been suicidal, and we know that when we talk about suicide and we give people information about suicide, that it can increase the risk of suicide, but we now know more about what that's about. So if you give people information about the method of suicide, or if you really glamorise suicide and tell people what suicide has achieved, and we know that there's a lot around how the media reports suicide that influences what people do when they're in a crisis. But simply asking about suicide doesn't encourage a suicide attempt. In fact, it's the opposite. It opens up that conversation. It can be a huge relief. It can be a pathway to help seeking for that person. It can be a pathway through the suicidal feelings. And it's really important that we're able to ask that question and we're able to act in if the response is, well, yes, I have felt suicidal. But sadly, there was a belief that just asking or saying anything about suicide would put it into someone's head. That's absolutely not the case. So again, the proportion of people who believe this has gone way, way down. It's 4%. And it was 21% in 2015. So again, we're seeing a positive change here in terms of attitudes, and that's about suicide, a 17% difference there. And interestingly there, we have a gender difference that we're publishing a paper with the statistical analysis of all of this stuff. But that is significant, 3% of women and 6% of men. So we maybe want to dig a little bit deeper there in terms of who those groups are, and how we can start to raise awareness then of the importance of asking that question. But also the importance of talking about suicide in a very safe way. And knowing that if someone has a plan for suicide, certainly the plan is a red flag. But if someone's feeling suicidal, it means something needs to change. and that's where the conversation can go. Okay, another one. People who talk about suicide never attempt it. Again, this was something that people used to believe. Again, tied to this idea that it was a cry for help, that people use suicidal talk about suicide to maybe manipulate people around them and stuff like that. Absolutely not the case. People who talk about suicide often do attempt suicide, and we should take it very seriously when someone is speaking about ending their life. So 5% in 2021, a big drop from 25% in 2015. So that's 1 in 5. That drop has been 20%. So that's really, really important that shift is happening, that we now recognise that when someone is speaking about suicide, they're disclosing that it needs to be taken seriously at all times. So that's very positive. The fourth and last question about suicide: if someone wants to end their life, they will, and there's nothing anybody can do about it. And I've heard this one myself. There's nothing we can do. And sometimes it is very, very difficult. When you hear about a case, it's very difficult and sometimes impossible to think of how that individual case could have been prevented. But broadly speaking, we know that suicide is preventable. We know that by giving people suicide-specific treatments, safety plans to keep them safe, and working with them to change the things in their life that have led to those suicidal thoughts, that we can prevent a death by suicide. And when we do that at a population level, you start to see the rates of suicide go down. And we're applying it at the minute in mental health services in a Towards Zero Suicide programme, recognising that there's a lot we can do in that context to drive down the numbers and the proportions of people who die by suicide. So there's lots we can do to prevent suicide. It doesn't mean that anybody individually is to blame when someone else takes their own life. It's nobody else is to blame for that. But as a mental health care system, as a society, and as individuals and families, we can open up conversations. We can prevent the suicidal thoughts from escalating to that point. And there's evidence now to support that. So when I say suicide is preventable, I'm not saying there's anybody to blame, but arguably the person themselves who did the act that led to their death. But that we need to be doing more to prevent suicide generally too. And that's why we have a Protect Life and Protect Life 2 suicide prevention strategy and a Towards Zero Suicide initiative and mental health services. So what is our study telling us here? Well, again, really positive change, but the number there, people who still believe that, is a little bit high for my liking, and it's still at 14%. We need to be driving that way, way down. We need people to realise that suicide is preventable, but we also need to realise that no one else is to blame, because people who are left behind are really, really struggle with that. So that's a tricky one. We need to navigate that. But 14%, it's a positive shift in the right direction, and that figure was 48% in 2015, so that was half the population then. So a dramatic decrease there, although I would be saying it can go down further. Okay, so there's a lot of stuff in there around getting help and getting support and suicide being preventable, mental health problems being preventable. But who do we ask for help from when we're struggling ourselves? When we think there's something wrong, there's something not quite, I'm not feeling right, and it's lasting a bit too long, it's more than the ups and downs of life. That's the kind of stuff. We all have days where it's stressful, and normal stress is what gets us out of bed in the morning and helps us get surveys done in time and reports in and doing the good stuff. So there's a bit of stress about that. But when it starts to, impact our moods and emotions, and we're feeling down or depressed or anxious a lot of the time for an extended period of time, it's a sign that something's wrong. Okay, so who do we ask for help from? Oh dear, I've just remembered I set up the animations on this. So let's see if this works. So we asked that question, and a lot of people in our survey said they have no emotional or mental health problems. This was in the last 3 years, by the way. So who did you ask for help from if you had a mental health problem in the last 3 years? So 39% of people told us no, which is great, and lucky them, because I know at the start of the pandemic I certainly was in this sort of state of chronic anxiety for a while, wondering how it was all going to turn out and how I was going to cope. So 39% is high enough there. And there were more males than females, so nearly half, 47% of males said no mental health problems or emotional health problems. We kept it soft, so we weren't talking about mental illness here clearly. 1 of 3 females said that as well. And that matches actually what we know about the mental health impact of the pandemic. Women were, by and large, worse affected than men, particularly around juggling multiple roles, and more of the health service workers were women as well. So we might expect that kind of gender difference there, and all of the other studies are showing that gender difference too. So the next questions are about those people who said something else to us, indicating that there was a time when they might have had a mental health problem, and 34% of that group had not sought support from any source. And you know, we're including family, friends, talking about stuff to people. This is not something that people needed to go to the doctor with, but there was an option there for family and friends, and they weren't taking that box, so it was all held in. You know, and that's difficult. There's a physical health impact over time because of your stress responses going off, and that can lead to chronic conditions and all sorts of problems there too. So 34% have not sought support, managed it or didn't manage it or whatever they did, and there was 46% of males and 25% of females in that category. 47% of those who had a problem accessed help from a professional source, and that was our next biggest category. So a lot of people are going to professional sources for mental health stuff these days. So that message has got through. People know they can ask for help, and they go to medical sources for that help. And we need to listen to that, and we need to prepare our health service for that. So 53% of females and 40% of males. Around a third there access support from informal social networks. You know, the kind of thing I would have done, phone people up, arrange Zoom meetings, coffees outside, socially distanced and all that stuff, just to have a good old moan and a mope about how terrible everything was. And you know, so 32% did that, 37% of females and only a quarter of males did that. We do really need to normalise talking about our emotions and feelings and how we are to each other, just how we're doing, you know, and to put it in the language that we would use here. And then we have the 13% who access help from both professionals and informal sources as well. So very, very interesting, I think, when we look at the next slide, which is the sources of help and support. So again, we asked people, I think it was 2 or 3, I can't remember which was which, but we asked people to pick a couple. So they weren't able to go down like the voting. They weren't able to go down the page and go 1, 2, 3. They just had to pick a couple of these. I think this was 2 and the other one was 3. Anyway, it's in the report. But look, the top one there was the GP. And that was like, let me have a wee look at that. Nearly half people who go to their GPs would go to their GPs. This is a speculative question. Well, who would you go to? Nearly half of them would go to their GPs. So that's an important message. A lot of the GPs are now doing the triage over the phone. So how's that going to impact on this stuff? Or how can we get that, you know, how can we improve that there, if that's where people are going? And then the friends was the next most popular one. And friends are very, very important, because sometimes your family is the cause of your mental health problems or your stress. So being a good friend is a really, really important thing, being a friend who can listen and have those conversations. I think that's something we want to be doing more of, just raising awareness of the importance of friendships. Then the spouse, of course, husband, wife, partners in there, and that's good. Again, it's lower down than friends, and a lot of people are single who don't have partners, and we know that their risk of mental health problems are higher. So, and then we have other family members. And then you go way down, there's a group in there next, deal with it by myself. I will not tell anybody, this is not something we're going to discuss. And that's good if it works, I suppose, but you know, we are as a species designed to connect, and that's how we regulate. So if you could do it a different way, it might be more effective. But, and then parents, care, mental health professionals, clergy, there's all sorts of things. And interestingly, I would like to see our helplines. How pushed up that list. I know we've got Lifeline and Smartens here today, so helplines are there 24 hours a day. Great source of support, and yet they're way down there. Employers are also a great source of support. Many of the big companies in Northern Ireland have wellbeing programs happening there, so let's use those when they're there. Social media, apps, all of those things are way down. Chemist and pharmacist is potentially a source of help and support. If you're on a medication, particularly, and you're trying to manage that, then the pharmacist should be higher up there too. So, interesting applications. So now I think this is the last one. Which government policies should be prioritised? So the top one, again, we asked people to choose two here, and the number one was quicker access to mental health services. So it's great we've representatives in the Department of Health here, but I think that's a very strong message about what people want right now in terms of the delivery of the mental health strategy. And times, because there's a couple in there that relate to mental health services, timely free access to talking therapy and counselling is further down. So these questions were pulled from so there's a bit different kind of questionnaire, so there's a bit of overlap in them as well. But people put their first tick there. And then the second one's really interesting too. Better support to help people get jobs and stay in work. Recognising the importance of having work, having a reason for getting up in the morning, and the importance of that in terms of your mental health and well-being. So that's number two. And then number three, and I'm delighted to see this because I really support this idea, ensuring everyone has a basic income. So that universal basic income campaign, that we're kind of given a nod to that. We didn't provide any more information about what that would be or what that would look like, and people may have interpreted it in different ways, but recognising the importance of financial issues to people's mental health and well-being as well. And now we're really in the middle of the economic impacts of everything that's been happening over the last few years. The cost of living crisis is now something that trips off the tongue, and we talk about it, it's a thing. So maybe that would be even higher up. So making sure people have enough money in their pockets, enough income to survive is good. And then I'm delighted to see promoting and sustaining children's mental health and well-being in schools there as well, because that is absolutely fundamental. When you're thinking of the age group that we're talking about, the brain's developing, stress response is being calibrated there. That's where the adversities, the stress actually does impact on educational outcomes, mental health across the lifespan. And there's so much we can do to intervene early when there's problems and to help children with that emotional regulation stuff and get them to the point where they are able to navigate their own feelings and to self-manage. So really good that that's there. And then waiting lists for non-mental health problems are in there as well. So health reform to domestic abuse, and then we have therapy. Loneliness, the theme of Mental Health Awareness Week is loneliness, and loneliness is quite high up the scale there, action to reduce loneliness. So really interesting priorities there, and hopefully they'll be taken on board. And the next stage is so let's go through the key points, and then we'll get to the next stages actually. Okay, so the key points from our survey. Stigma has gone down. Asking for help is now viewed as more acceptable. So that is good. We know that you shouldn't just live with poor mental health. There's help out there. It's a sign that something's wrong. It can be changed. We can work with this, so that's a really good positive thing. There's been a notable reduction and an important reduction in the percentages of negative and inaccurate beliefs about suicide. And we maybe talk a wee bit more about that in the chat, I was going to say, in the Q&A. See how you change it. In the Q&A why that is. But I think it is due to the great work of the suicide prevention organisations and people on the ground across Northern Ireland who are raising awareness, who are busting those myths, and who are doing the work to prevent suicide. So thank you so much to them. There's many of them in this audience, so that's great. But many of us still find it difficult to talk about our feelings, and that's the starting point. So people asking for help when it gets too much. talking about feelings, we're not doing that. A lot of us have difficulties with that. And many people who are really struggling with how they feel are not accessing support from any source and are not making those connections with family and friends that would really, really help them and prevent a lot of mental health problems from escalating and help people solve real physical problems that have led to the stress and distress that's affecting their mental health. So people want accessible professional mental health services. Really important, very strong message from this survey is that the professional mental health services have to be there, and that the GP and the primary care context remains the most important source of help. So we need to see how well primary care services are set up to meet that demand that's now out there. People are coming forward and asking and expecting mental health support through primary care, and we can talk a little bit about what that might look like, given the challenges that we have right now affecting the health system in general. And then finally, spouses, partners, friends, and family were all key providers of mental health support, that should be. But all of us in our families and communities are providing mental health support. We are all part of that picture. We all have a role to play in this, whether it's talking about our own stuff, if it's us that has difficulties, or connecting with other people and listening and being a good friend and helping people navigate the problems in their lives that are creating distress and stress. So I think that's another really important message to take away from today. So what I'll be doing going forward is having lots of discussions with key policymakers around this data and what the messages are and what that tells us in relation to the delivery, particularly of the mental health strategy. But I'm going to be writing to all of the MLAs because there's stuff here about education, schools, income, society. It's everything really, isn't it? Like, it's not just health and health services. So there's messages from this survey for all of the government departments here too. So I'm going to be writing those letters, and we're going to be doing more number crunching of the data, looking at gender, rural, urban, all of that stuff, and getting a few peer-reviewed papers out, which is very important for me as an academic too. And hopefully you'll be able to take some of these key messages out into your own organisations and help us with that work that we're doing across Northern Ireland to make things better, to improve the mental health and well-being of the whole population here. So thank you so much for listening to me for all that time, and we'll now be able to have Karen's response and a bit of a chat. Thank you.
Thanks, Siobhan. I'm just going to change over. Please. So much easier when you don't have to share screen. So good. And hope that the technology works. So it's lovely to be here in person today. My name is Karen Hall. I work for the Mental Health Foundation. So after numerous years of seeing people on screen, it's nice to see people in person. Thanks a million for inviting us along today. As was indicated earlier, the Foundation did some work along with Art on the questions and with Siobhan. Shari, who actually was involved in that work, couldn't be here today. So I wanted to give you a wee bit of background to the Foundation. Some of you may not have heard of it before, and I'm hoping that will change. I've been in post now for a couple of months, so it's the first time. They keep calling me the presence in Northern Ireland. But yeah, I've been in post for a couple of months, and I know some people in the room, but not everybody. Just a wee bit about us, and I'll be very quick. It's not my 30-minute elevator pitch. It's just to give you a bit of context to why this piece of work is particularly important to us. So our vision is good mental health for all. And our work is around prevention. So the Foundation's been around for about 70 years. A lot of people here know it for its research, and Siobhan had said earlier about the economics report. So that tends to be what people think about it. Why we exist? So huge strides achieved in physical health, when we take a public health approach. No such progress in mental health. So that's really why we have taken that preventative approach. And a very brave statement, as people will say, mental health problems of all kinds can be prevented. Some people in the room may not agree with that, but we feel it's really, really strong just to say that and say that a bit about our purpose. just a wee bit, not working. Oh, missing the slide. But anyway, so before we get on to the reflections bit on the data and what we've seen today, just a wee bit about our how we work. So it's very much at different levels. So we're saying for everyone. So we can all have good mental health, but sometimes, as Siobhan has alluded to, and what she was saying, is we may need supports at different areas and times and points in our lives. For society, individuals, communities, we can all change stuff, but actually there's structural stuff that we need to change as well. So we need to work in those big structural changes as well as working with individuals and communities. And also then for those at risk. So we know, and some of the data is shown here today, that some people may be more at risk. And that's often down to inequalities. So a lot of the work that we do is through that social justice lens. And for those people who know me, they'll know why that's really important and why this role was really important to me, is around those social justice issues. So, some reflections. I've been given 5 minutes, so I can't talk forever. I didn't actually put them on a slide because I thought I might change my mind. So the big one obviously that stood out for me was that about 50% think that mental health problems can be prevented. So what that kind of said to me is, I've got a bit of work to do here, and as we build a team, but it's not just the foundation. It's at all levels. We as a foundation can't do that prevention bit alone. We need other people with us. I suppose what really struck out was the change around the attitudes and knowledge around suicide, and what that really demonstrated then was that change can happen. That we can make those shifts, and as Siobhan's already said, that's down to the many organisations and people in this room today who've put that huge effort into it and making that change. But I also think we need to know how that reflects on the ground and what that means and how our communities feel about it. The other bit that stood out was about 78% strongly agreed that there was less stigma nowadays. But as Siobhan picked up, 44% of people still said that they find it difficult to talk about their feelings. So that stigma may be, or people may think that it's okay to talk, but actually some of us still aren't talking. So we need to think about that. So I think what also that shows is around, and Siobhan talked about emotional literacy, but also that mental health literacy. So how do we talk about it? How do we know what it is? And I was at, these roles get very diverse. I was at a comedy night last night for Mental Health Arts Festival, and it was great. One of the comedians spoke very much about their own experience and used it, but they talked about having to walk into A&E, and she didn't know how to say, I have a mental health problem. She was on the way going, I don't know how to say this to somebody in person. And she used great humour to talk about it, but it just clicked with me that that's something that we need to think about. Do you want to mention our economics report as well? And for anybody that hasn't seen it, it's available on the website, or people can ask me about it and I'll email it to them after. And there's some great stuff in there around prevention and some of the things that have been demonstrated to work. So things like parenting support programs, quick access to psychological support, all those types of things. What we would say about the report and the examples in there, those are the only ones that we could actually measure. So there are lots of other really good examples, but we also really need to build the evidence about how prevention works and why we need to do it. So I would encourage people who are doing bits of work around that to get in contact and let us know, because a lot of what we want to do here is learn, but also evaluate and really show the value of that. So in terms of where I suppose it points to, the mental health strategy, we've all been involved in it. There's lots in it, but I suppose what we really want to see is some really quick action on those early actions. So particularly around prevention and early intervention, we need to get working on that now. There's lots within it. There's lots of things in the strategy that need to happen, but we need that particular bit of work to start, because it's a long-term thing. As the data shows, attitudes and change don't happen overnight, and we all know that. But yeah, so that's really important. So yeah, 74% agreed strongly that social disadvantage was associated with risk with poor mental health. And for me that was really enlightening and good to see that people do have that awareness between the social determinants of mental health, particularly around employment and income. And we know that's going to be really important particularly over the next while for where we are. But it also really shouts out to the fact that we need that mental health lens running through all areas of policy. It's not just the responsibility of the Department of Health, it's the responsibility of the Department of Communities, it's the Department of Infrastructure, it's economy, it's all of those departments need to see that the impact that they have on people's mental health and well-being. And particularly for me, it's around income at the minute. How can we, I'm not going to get into the politics, but how can we get income into people's pockets now? And to me, universal credit now with an uplift would be really good. I suppose one of the things that was slightly disappointing in terms of where things sat with the interventions was how low, I know it wasn't very low down, but it was quite low down in terms of school settings and early intervention there. You know, getting public awareness of how, if we can get to people early when they've had those adverse childhood incidents, having that awareness and knowing that there's stuff that we can do so that that person and that young person can actually have a better outcome in life is really, really important. So we'd like to see that shift up. There's loads of other things. Happy to chat about it afterwards. But really, thanks so much for the opportunity. It's going to be really interesting to see the additional data coming out, and like all nerds on the 26th of May will be sitting. So we'll go from election nerding to data nerding. So thank you very much.